I would now like to demonstrate the roll test, which can be utilized to assess for either horizontal canalolithiasis or cupulolithiasis. So before I actually execute the maneuver, what we need to do is discuss what it is that we're looking for to be able to differentiate between those two diagnoses. So with canalolithiasis, the duration of the symptoms will actually be short-lived, and the direction of the nystagmus will be geotropic, which means that the fast phase of the eye beating will be towards the ground. Now, contrary to that, if it's cupulolithiasis, the direction of the nystagmus will be ageotropic and will be pointing towards the ceiling. As well, the symptoms will be long-lasting and will not subside. So what we want to do before we execute the test is to position the neck into about 20 degrees of flexion. So I'm going to lift up here, the head of the plinth. All right, go ahead and slide down just a hair for me. Great. Making sure we're getting the flexion at the neck. All right, very good. And so to execute this test, all we're doing is we're asking the patient to go ahead and roll their head to one side. So go ahead and do that for me. And maintain eye contact on my nose, please. Assessing for the direction of the nystagmus, as well as the duration. My patient does not present with any nystagmus, so I'm just going to go ahead and ask him to roll to the other side. Again, assessing the eye movements. My patient is demonstrating none. So, what we can do now is we can modify this procedure, either for a patient who is not demonstrating horizontal canalolithiasis currently, but you suspect may suffer from the condition, or from, say, a frail population that cannot move very well at their neck. They're limited with rotation. So what we'll do is we'll ask Matt to slide over to the right for me, please. Keeping your right knee bent, go ahead and straighten out your left leg. What I want you to do now is roll completely onto your left side while rolling your head as far as you can, okay? So go ahead and roll over. Here we go. Oh, and look at me here. Very good. Again, assessing for eye movements. So basically, this is just creating a greater range of motion with which the debris can migrate through the horizontal canal. And go ahead and roll all the way to the other side, being careful not to roll off the plinth. And again, assessing for the eye movements, as well as the duration of the symptoms. And that is how you execute a roll test.